Right now on the internet, there is an entire movement of men dedicating their lives to something called looksmaxxing. And listen, I get it. We all want to look our best. But some of these guys are taking Adderall, injecting GLP-1s, blasting anabolic steroids, holler at your boy, and in some cases, literally smashing themselves in the face with a hammer to make their cheekbones more prominent. A hammer to the face. And then there is whatever is going on with these hyoid bone exercises where guys are literally hanging their heads off the end of a bench and opening their jaws repeatedly. And look, I'm not going to say what it looks like, but if you've ever seen a certain genre of online video that features bad acting and a conspicuous black leather couch, you already know. But here's the thing, most of these guys are doing all of this to become more attractive to women. So why are we messing around with cheekbones and jawlines when we could just skip to the main event? That's right, folks. Today, we are talking about penismaxxing. Now, before we go any further, let me be very clear about something. Your happiness, your personal satisfaction, and your sense of wholeness as a human being are not found in the dimensions of your junk. They're just not. And believe it or not, maxing your equipment is highly unlikely to make you more popular with the opposite sex. However, there is a staggering amount of interest in this topic. And as a board-certified urologist and fellowship-trained men's health specialist who literally operates on this organ for a living, I felt it was my duty to separate fact from fiction when it comes to my organ of surgical subspecialization. So strap in, or actually don't, that's going to be relevant later, and let's get into it. Okay, before we can talk about optimizing anything, we need a quick crash course in penile anatomy, because if you don't know what you're working with, you have no business trying to upgrade it. The penis is made up of 3 cylindrical bodies of tissue. On top, the dorsal side, you've got the 2 corpora cavernosa. These are the main event for erections. They're composed of spongy erectile tissue surrounded by a tough fibrous sheath called the tunica albuginea. When you get an erection, blood flows into the corpora cavernosa, the tunica stretches, blood gets trapped, and congratulations, you have liftoff. On the bottom, the ventral side, you've got the corpus spongiosum. This guy surrounds and protects the urethra, which is the tube you urinate and ejaculate through. You do not want to mess with this one. I cannot stress this enough. Believe it or not, I am not looking for more business here, people. And at the tip, the corpus spongiosum expands into the glans penis, the head. It's loaded with nerve endings and is responsible for a lot of the sensation during sexual activity. Okay, so that's the playbook. 2 cavernosa on top for erections, 1 spongiosum on the bottom protects the plumbing, and the glands up front running sensory operations. Got it? Good. Now, let's talk about making it bigger, because apparently that's what the internet wants. And literally every man that's ever lived. All right, penile lengthening, the holy grail of the looksmaxxing adjacent male internet. Now, the penis is soft tissue, not bone, hardy har har, so one would think that gradual sustained tension could, over time, improve length. And you'd actually be partially right. But let's start with the terrible ideas first, because there are a lot of them.
For increasing size was another one.
You think from makes your bigger?
Only when you're young, right? Your penis development stops when you're around 16.
First terrible idea. Hanging. Yes, there is an entire internet subculture dedicated to literally hanging weights off the penis to stretch it longer. And I don't care what some anonymous Reddit moderator with a concerning post history tells you, do not do this. There is 0 peer-reviewed data supporting it, and the potential for neurovascular injury is real. Second bad idea is jelqing. This involves repetitively pulling on the penis in either, let's call it, violent fashion, or shall we say, a more sultry approach. Either way, there is no data supporting that jelqing produces durable gains in penile length. What there is data on is that jelqing can cause significant penile injury. A 2015 study in the Journal of Sexual Medicine found that men attempting techniques like jelqing reported poor success, and I want to emphasize, poor in the published literature is being generous. Case reports have linked aggressive jelqing to Peyronie's disease, penile fracture, and vascular damage. Just don't. But here's where things get interesting. There is logic behind the concept of penile traction. The idea that sustained, controlled mechanical force can remodel soft tissue is well established in medicine. It's the same principle behind tissue expansion in plastic surgery. So let's talk about options that are safe and have actually been proven to clinically work. Now, we have an entire class of devices for this, and they're called traction devices. My favorite traction device is something called RestoreX, which was originally designed for Peyronie's disease, a condition where scar tissue causes the penis to curve. But it turns out the length data behind RestoreX is legitimately impressive even outside of Peyronie's. A 2025 narrative review that analyzed over 1,000 patients across 15 studies found that modern traction devices like the RestoreX achieved average average penile length gains of 1.5 to 2.3 centimeters with protocols of just 30 to 90 minutes of daily use. Adherence rates exceeded 85%, and adverse events were mild and usually didn't last very long, mostly some temporary redness and temporary numbness. And a randomized controlled trial out of the Mayo Clinic found that in post-prostatectomy men, so men who had had their prostate removed for cancer, RestoreX achieved an average of plus 1.6 centimeters of length gain versus just plus 0.3 centimeters in control, along with significantly better erectile function, intercourse satisfaction, and overall sexual satisfaction scores. 87% of users said they'd repeat the therapy, and 93% would recommend it. That's RCT level data, folks. Now, is RestoreX overkill if you don't have Peyronie's and just want more length? Maybe, but the data is there. It's one of the very few things in this space that is actually supported by clinical evidence. So a quick honorable mention, vacuum erection devices or VEDs do exist, and they are a great option for men trying to rehabilitate their penis after injury or prostate removal, but they have never been shown to produce durable length gains in otherwise healthy men. So if you're a healthy guy buying a penis pump off of Amazon hoping it'll add inches, just save your money. Oh, and yes, there are technically surgical options for penile lengthening, but they're all some sort of shade of terrible, with complication profiles that sound like they came straight out of a Saw movie. Suspensory ligament release can technically reveal hidden length, but you risk an unstable erection, loss of that natural angle, and scarring that can actually make your penis shorter. I would not recommend any of these surgeries, and neither would any reputable urologist that I know. So let's move on to the next topic, which is girth enhancement. And unfortunately, when it comes to increasing penile girth, there's really nothing you can do at home. There aren't any exercises, no devices, and no supplements, at least nothing that's been proven. Nothing your favorite Looksmaxxing influencer is going to sell you in a link in bio product is going to add circumference to your penis. I'm sorry. But that doesn't mean that we don't have options. So let's talk about what's actually out there in the procedural world. There is a surgical option called the Penile, also recently rebranded as the implant. It's basically a silicone hot dog bun, yes, I said hot dog bun, that wraps around the shaft of the penis while avoiding the urethra, and it is surgically implanted between layers of connective tissue. Now, have there been class action lawsuits against the surgeon and inventor Dr. Elist? Yes. Have most of the reputable surgeons that I know personally given up on Penile because of, and I'm quoting here, horrible complications? Also, yes. Am I choosing my words very carefully because the Elist family is notoriously litigious? Absolutely yes. That being said, would I ever recommend the Penile to even my worst enemy? Hell no. Don't believe me? Check out this incredibly well-written 2023 investigative journalism piece published by Ava Kaufman at ProPublica. Ron, just put the link in the description. Okay, so with surgery out of the way, what non-surgical procedural options do we have for increasing penile girth? Now, we actually covered this pretty in depth in our video talking about Olympic ski jumpers. Yep, that video exists. Check out the link above. But injectable filler placement, specifically with hyaluronic acid, can be safe, reproducible, and aesthetic if done by a qualified provider. Full disclosure, this is something that I do as part of the Falafel group, so I'm obviously going to be biased here. But the data has been published and peer-reviewed. Hyaluronic acid fillers are biocompatible, reversible with hyaluronidase if something goes wrong, and when placed by someone who actually knows something about penile anatomy, like this guy, the results can be natural looking and satisfying. However, other filler materials like silicone and PMMA, polymethyl methacrylate, are complete and utter dumpster fires and should be avoided at all costs. Sometimes we can fix the problems they cause, but a lot of times we can't. I have seen things in the OR from botched silicone injections that would make a horror movie director flinch. Please, please do not let anyone inject permanent foreign material into your penis. All right, so we have covered penile dimensions, but let me ask you something. What good is having the biggest cannon on the battlefield if you can't get it to fire? That's right, we're talking erectile function. Now, let me be crystal clear here. This is not going to be an exhaustive discussion of how we treat erectile dysfunction in a clinical setting. What we're talking about are interventions that already healthy men without medical problems can employ to get the absolute most out of their equipment. Think of this as performance optimization for a healthy engine, not fixing a broken one. So, the penis is a vascular organ. That means that whatever is good for your heart is good for your erections. Full stop. The arteries that supply the penis are some of the smallest in the body, which means they're often the first to be affected by vascular disease. In fact, Erectile dysfunction is frequently an early warning sign of cardiovascular disease, sometimes showing up 3 to 5 years before a patient's first heart attack. A 2024 meta-analysis analyzing over 27,000 participants found that a combined diet and exercise program significantly reduced the likelihood of ED, with an odds ratio of 0.49, essentially cutting patients' risk roughly in half. Diets rich in fruits, vegetables, and nuts were correlated with lower ED risk across the board. So if you're watching this while eating Taco Bell on the couch, no judgment, we've all been there, but understand that your choices are directly affecting your erections. Now, cardio helps erectile function. Managing your lipids helps erectile function. Avoiding diabetes at all costs helps erectile function, because diabetes absolutely destroys vascular tissue over time, and the penis is one of its first casualties. Your diet matters. Your activity level matters. Your erections are a report card for your vascular health. Now, as far as supplements go, let's talk about L-citrulline. Here's the deal. What we're actually going for is L-arginine, because L-arginine is a precursor to nitric oxide, which is the molecule that kicks off the entire erection cascade. But the problem is oral L-arginine has terrible bioavailability. Your gut and liver chew it up before it ever gets to where it needs to go. So instead, enter L-citrulline. Your kidneys convert L-citrulline into L-arginine, effectively bypassing the first pass metabolism issue. A clinical trial found that 1.5 grams per day of L-citrulline improved erection hardness scores from a 3, which is mild ED, to a 4, which is normal, in 50% of men compared to only 8.3% in a placebo. Frequency of intercourse also significantly increased. It's not as powerful as a PDE5 inhibitor, but it's over the counter, it's safe, and it's got actual data behind it. Now for the doctory stuff. And look, this may be considered aggressive, but I am a big fan of tadalafil 5 milligrams a day, even in healthy men. Now, you probably know tadalafil as Cialis, but the benefits go way beyond just getting erections. A 2024 study looking at over 29,000 men with ED found that tadalafil exposure was associated with a 19% reduction in major adverse cardiovascular events. That's the composite of cardiovascular death, MI, revascularization, unstable angina, heart failure, and stroke. It makes all of that go down. Men taking tadalafil had a 55% reduction in cardiovascular mortality and a 44% reduction in all-cause mortality. And men in the highest quartile of tadalafil use had a 60% reduction in major adverse cardiac events compared to the lowest quartile. A separate study confirmed these findings, showing tadalafil was independently associated with a 41% decreased risk of major adverse cardiac events and venous thromboembolism in men with lower urinary tract symptoms. And although this hasn't been formally studied long-term, the majority of physicians specializing in erectile dysfunction believe, as do I, that tadalafil may actually help delay the onset of ED due to its mechanism of action. Sustained PDE5 inhibition promotes regular smooth muscle relaxation, oxygenation of erectile tissue, and potentially prevents the fibrotic changes that lead to ED over time. So you're looking at a single daily pill that gives you better erections, protects your heart, reduces stroke risk, and may prevent ED from developing in the first place. That, my friends, is what we in the medical community call a no-brainer, worth a conversation with your doctor at a minimum. And lastly, for this section, we're talking shockwave therapy. Low-intensity extracorporeal shockwave therapy, or LI-ESWT, sits in a really interesting space. It is a legitimate treatment for ED, and a meta-analysis covering 14 studies and 833 patients found that shockwaves significantly improved both sexual health scores and erection hardness scores, with benefits lasting at least 3 months. But, and this is a massive but, it works really best in mild erectile dysfunction or before anything really bad has happened. A separate meta-analysis confirmed that favorable outcomes were primarily observed in cases with mild or moderate ED. Once you're past the mildest form of ED, you'd be better off burning your money in a furnace, because at least then you get some heat from it. So instead of thinking of shockwave as a rescue therapy for broken erections, I actually think it likely sits best as a first line or even preventative intervention for men who want to maintain peak erectile function. Start early, stay ahead of the curve. Pun fully intended. That's a Peyronie's disease joke. If you want to learn more, check out some of our earliest videos. And finally, we got to talk about hormones, specifically testosterone. Now, for most of my lab rat army out there, this is not going to be a surprise for you, but we know that testosterone is essential for initiating the chemical cascade that produces an erection. It stimulates nitric oxide synthase in penile tissue, facilitates smooth muscle relaxation, and it modulates libido, which is the I want to part of the equation that no amount of Cialis can replace if it's missing. Low testosterone, or hypogonadism, is strongly associated with erectile dysfunction. The data on this is overwhelming and well established across decades of research. Men with low T are significantly more likely to experience ED, reduced libido, decreased sexual satisfaction, and overall have an impaired quality of life. Now, honest question for you guys that have watched this far. Would you be interested in a full deep dive video on evidence-based ways to boost testosterone naturally? Because I've got a lot to say about that. And if so, smash the comment section and let us know. But here's what I'll say right now. Physical activity and physical fitness are some of the most powerful tools that you're going to have for maintaining a healthy testosterone level. Resistance training, adequate sleep, and maintaining a healthy body composition, these aren't just vague wellness tips. They directly impact your hormonal environment and by extension, your erectile function. Shout out to Brian Johnson bragging about his nocturnal hard-ons on Twitter. Now, if you are truly hypogonadal, meaning your testosterone levels are clinically low and confirmed by blood work, replacement therapy can be genuinely life-changing, not just for erections, but for energy, mood, body composition, bone density, and overall quality of life. And that's a conversation that you should have with a doctor if you suspect something is off. And not with the guy behind the gym. That's how you get trim, which you shouldn't be doing. Video's up here. So, all right, guys, let's bring it home. So, look, the Looksmaxxing community has some genuinely interesting ideas, and I want to respect the motivation behind wanting yourself to be, well, your best version. But when it comes to your penis, there is so much misinformation out there that it can be legitimately dangerous. So here's your evidence-based Penismaxxing cheat sheet. For length, traction devices like RestoreX have actual RCT data behind them. Everything else is either unproven or a trip to the emergency room waiting to happen. For girth, hyaluronic acid filler done by a qualified provider is the only option that I can get behind. Stay away from silicone, PMMA, and anything with the word pneuma attached to it. For function, and this is a big one, get your cardio in, eat your vegetables, consider L-citrulline, and talk to your doctor about daily tadalafil, and maybe look into shockwave therapy. Your erections are a window into your overall vascular health. And when it comes to hormones, stay active, stay fit, and get your testosterone checked if something feels off. The penis is actually a pretty incredible organ, and you only get one, except for that one double dick guy on Reddit, but I'm gonna let you guys Google that one on your own. So treat your member with the respect it deserves, and for the love of everything sacred, put down the hammer. So if you learned something today, hit that subscribe button and the notification bell so you never miss a video. Drop a comment telling us what topic you want us to tackle next, and share this video with a friend who needs it. We both know you've got one. I'm Dr. Alex. Stay healthy, stay informed, and I'll see you in the next one. Proceed accordingly.